I am Dr. Iqbal Siddi Ganie. I'm a musculoskeletal radiologist here at Smit and Partners. I've been doing musculoskeletal radiology for nearly a decade. And musculoskeletal radiology basically is the specialist interest in imaging of the bones, joints, tendons, and muscles. It includes diagnoses, so looking at CTs, MRIs, ultrasounds, or interventional procedures, which could include bone biopsies, tendon injections, joint injections, arthrograms, or Botox injections as well. So my approach to a complex MSK case is no different from the approach that I would apply to a simple MSK case. The foundation and the principles are the same. So starting with the history that we get from the patient, the physical examination findings, the investigations or blood work that was done alongside that, and then implementing the right protocol. In other words, utilizing the right modality, be it X-ray or ultrasound, or in some instances, MRI might be the first modality of choice. So if we utilize the right protocol, we will not only be able to simplify the approach to the complex case and get the diagnosis, but it will also allow us to report the case in such a way that it is simplified for the clinician who sees it, and that will help to guide the management and approach to treatment. So at Smit and Partners, we understand the demand for radiology has increased significantly over the last few years. And we know that patients get booked into the hospitals and they might have their surgery the same day, or they are traveling from afar to come and get their treatment. So previously in the past, if we had started with reporting some X-rays, these days I might find a complex MRI case waiting on my desk at 8 o'clock. So we will probably start with reporting some of the higher end imaging. And this could be mixed with some X-ray reporting in between. And we would also have procedures booked for us, be it bone biopsies, tendon injections, or joint injections. And at the end of a long day, we might find ourselves with another complex MRI case. But overall, although it's very demanding, it's also very rewarding at the same time, because we know that these patients are getting a quick diagnosis. Coming back to the point I made about having a strong, basic, fundamental approach, be it for a simple or complex case. The case that I was faced with many years ago was a group of twins that had come in. The first twin had presented with lower limb swelling or lower leg swelling with redness and pain, and he had an MRI and the features were suggestive of a tumor. He went for a tissue diagnosis or tissue biopsy, and it confirmed a tumor that he had. And his brother had come in 1 week later with a similar presentation. And looking at the history, the examination, looking at the basic protocols, how you would plan in terms of your imaging, whether you need to do an X-ray with that or an ultrasound. Although they looked very similar, the brother ended up having a tissue diagnosis of an infection. So by being able to differentiate between the two, we were able to guide management differently for both patients. The thing that I find most rewarding about Smit and Partners is that we have a collective group of years of experience, subspecialty skills and interests, and we are able to tap into each of that from all of our colleagues and partners to make the right diagnosis as well as to provide the best treatment for our patients. As a musculoskeletal radiologist, I think we also understand that everyone, including us as doctors, experience some sort of tendon, joint, bone pain, or muscle pain at some stage. And we know the impact it has on a person's quality of life and their day-to-day activities. So when we are able to make that diagnosis or we are able to treat that condition, it's incredibly rewarding because we know the impact it has on their quality of life and the improvement it makes. And that's something we'll always strive for here at Smit and Partners.